I would now like to introduce the San Antonio Chamber of Commerce Executive Vice President, Dave Peterson.
Good afternoon and welcome to the San Antonio Chamber of Commerce Log In and Learn webinar series. This one is the Military Mental Health and Wellness Resources, and it's presented by our friends at Endeavors. Today's event is brought to you by Civil Engineering Consultants, the San Antonio River Authority, and Silver Eagle Beverages. Thank you so much for your generous support. I would also like to thank our Chamber staff for their hard work in organizing this live event and for all of those of you that are taking time out of your busy days to participate. For the past few months during these challenging times in our city and across our nation, our Chamber team has worked diligently to ensure our members and the surrounding community have what we need to stay informed and educated about the resources available to us to remain engaged and supported. As Military City USA, we have a great responsibility to show our admiration and appreciation for the sacrifice of our military men, women, and families now more than ever. During today's event, we will hear how we can support the psychological health of our service members, veterans, and families, understanding that their profession and the weight of their selfless service can take a toll. We will focus on the important work being accomplished to help them navigate the stressors of military life, as well as shine light on vital initiatives that aim to prevent homelessness, crisis, and isolation. And don't forget, we want to hear from you. If you have any questions for any of our speakers, please put them in the Q&A box and we will get to them at the end of the program. It is now my distinct honor to introduce John Allman. San Antonio is proud to be home to many organizations that support our military, veterans, and families. Today, we are highlighting the initiatives from our partners at Endeavors, which is a San Antonio-based organization with a long-standing and far-reaching national impact. It is my pleasure to introduce John Allman, President and CEO of Endeavors. John graduated from the Air Force Reserve Officer Training Corps program at the University of Arkansas in 1987 and spent 20 years as a career Air Force officer flying combat missions and leading our nation's finest airmen in peacetime and in war. Now he leads an Endeavors team of over 2,000 employees to help restore dignity and improve the quality of life for vulnerable people in crisis across the nation. John, we are honored that you and your team are here to provide us a glimpse of the great work you are accomplishing. Welcome to our event.
Thank you so much, Dave. We really appreciate the Chambers giving us time today on this webinar to spread this very important message, especially during this very stressful time of COVID-19 operations on our military who don't have an opportunity to really get together and spend time with family because they are still out there preserving our nation's freedom and defending all of us. Urban Ministries was our founding partner here at Endeavors in 1969. 5 Presbyterian churches founded what is now Endeavors. We have 3 pillars of services, which include veteran services, community-based services, and disaster recovery. Our mission is to passionately serve vulnerable people in crisis, and we get lots of great opportunities to do that, and many of us are excited to be performing in that role. We have a heart for our veterans, though. In fact, many of the presenters you're going to hear today are veterans, to include our Chief Operating Officer, Chip Fulghum, who will give you some detail on what we're doing here at Endeavors. I also want to mention that later this year, we're going to take delivery of the very first of its kind Veteran Wellness Center here in San Antonio, the first of its kind not only in the state of Texas, but we believe across the U.S. to serve our veterans. So Chip is going to give us a few details about what we do here at Endeavors in our operations, and we're excited to serve. Thank you for logging in.
So good afternoon. As John said, Endeavors has been around for over 50 years as serving vulnerable populations in crisis. We have 3 lines of service that we provide those folks. Our first is our community-based service programs. Several lines of effort there. The first of which is we operate 2 shelters for single women and their children, the women who have suffered from some form of mental illness and some form of domestic violence. We operate a shelter here in San Antonio for 20 women, and when you add in their children, about 56 to 57 folks, as well as one in Fayetteville, North Carolina. In addition to that, we perform assessments for The state, as a part of their foster care system, we perform about 4,500 assessments in 4 regions across the state of Texas, including the Bexar County region. And then we have employment supportive services by our Endeavors Unlimited folks that provide employment for those individuals who suffer from some form of disability, providing custodial and landscaping services, not only here in San Antonio, but in Dallas, Fort Worth, El Paso, and Houston. As John said, we also have a large disaster case management program as a part of FEMA's long-term disaster recovery efforts. We currently operate in the state of Texas, supporting victims of Hurricane Harvey down in Houston, Beaumont, and Orange. We operate in North Carolina, supporting victims of Hurricane Florence in Jacksonville and Fayetteville, North Carolina, and 34 counties in the state of North Carolina. Just wound down an operation supporting victims of Hurricane Irma in Florida, where we had a presence in Orlando, Tampa, Jacksonville, and Ocala. And then in Puerto Rico, supporting victims of Hurricane Maria, where we support individuals in 50 of the 78 municipalities in Puerto Rico, helping connect those folks to resources, building an individual recovery plan for each one of them, having served well over 28,000 folks the last couple of years, and well over $20 million in resources that we've obtained for those folks, helping them get their lives back together and recover. The other thing John mentioned was our rapid response capability. We have 1,600 reservists that we have employed with Endeavors, that within 48 hours we can call up between 150 and 200 of those folks to go staff, to provide staffing support in the case of an emergency, particularly shelter operations. As you look at the COVID response, a part of that is obviously the need for shelters and shelter type operations. And we currently are staffing shelters in Dallas, helping the overflow created by the need for social distancing and their homeless population in Dallas. 2 in El Paso, 1 right here where we're helping the Children's Shelter in San Antonio, helping the Salvation Army in Dallas, Fort Worth, and recently signed an agreement to help staff a facility in Harris County. And then what we're going to focus on primarily today is our Veteran Support Service line of effort. Annie will talk to you in a minute about our support to homeless veterans and that the fact that we are currently in 81 counties in the state of Texas, soon to be 96 on 1 October of this year, helping with rapid rehousing and homeless prevention of about 1,000 veterans and their family members each year. And then Dr. Palmer is going to talk to you here in just a minute, along with Kimberly, about our Stephen A. Cohen military family clinics, where we currently operate clinics that provide military family members, post 9/11 veterans and their family members, mental health services in El Paso, 1 in Killeen, and 1 here in San Antonio, that are currently operating 120% or 100% remotely, and have served over 3,000 appointments over the last 2 months, and are doing a tremendous job of helping folks provide a variety of mental health services to those who have already sacrificed so much for us. The other thing I would mention is, I saw one of the questions earlier is, can we serve active duty dependents? The answer is yes. About half the folks we see, or 25% of the folks we see, are active duty dependents, and we welcome those post 9/11 folks as well. So at this point, I'll turn it over to Jill and Kimberly to talk to you about some of our wellness programs.
Excellent. Thank you, Chip. Hi, everybody. It's really excited to be here with you all. I am the Senior Director of Clinic Operations for Endeavors, and I oversee the 3 Stephen A. Cohen military family clinics, which we have located in San Antonio, El Paso, and Killeen. And they are all providing services. It's short-term, evidence-based mental health services to post 9/11 veterans, active duty spouses and family members, and family members of post 9/11 veterans. So if there are services you're looking for to support transitioning out of the military, PTSD, mental health services, depression, anxiety, family relational needs, or family discord. We do a lot of marriage counseling and family support. We're doing all of that remotely with our virtual platform. We utilize Zoom as the HIPAA-compliant telehealth platform for those services. And those services happen mostly Monday through Friday. The San Antonio Clinic does have some offerings for Saturday hours. We have evening hours. We also have virtual learning opportunities with our life skills programming and outreach efforts. And all of that programming for life skills and outreach you can find on our social media pages for the clinics. You can also find the ability to connect with the mental health services virtually via our website by sending in a web link request or calling for a quick and easy intake process to make sure you're eligible for services. We also are really proud to talk about our virtual wellness services. So as John and Chip mentioned, Endeavors has embarked on a new implementation for a Veteran Wellness Center, which will be housed in San Antonio at a physical location on De Zavala. However, we have a whole host of mental health and virtual services. We are pleased to be able to announce that we will have mental health services starting in July that is being funded by the Texas Veterans Commission. And we have virtual services for wellness occurring now. We're supporting our employees, and we're doing some wellness services in conjunction with the VA with Friday workshops. And that's what we're going to work on today as well. We have a bit of a workshop activity we want to share with you. Wellness is something that we can choose and focus on in any way that we want to. I talk quite a bit about my addiction to chocolate and how that really helps me focus on wellness, but there are some other ways as well. We had some pre-questions about how to help employers or folks who are transitioning from the military be able to focus on wellness and support the difficult task that it is going from being on active duty to being a civilian. And one of the ways to do that is to manage stress. Some of the ways to manage stress can be really helpful with learning a specific technique. So we have Kimberly Anderson, our program coordinator at the Veterans Wellness Center. She's going to be teaching you a quick technique. It's called Emotional Freedom Technique, or tapping for short, and it goes right into teaching your body and training your body how to de-stress with the things that are going on. You can use this for things that are extremely stressful, like some of the isolation and the different events we've had over the last couple of months. You can also use it on more minor stresses or things that you've been trying to create, maybe healthy habits, or being able to focus in on a specific task. If maybe working from home is distracting because of different things, you can use the emotional freedom technique to help support more increased attention. So we have a bit of a video we're going to show you for the first minute or so of this presentation, and then Kimberly is going to take you through what the tapping is. So we can go ahead and play the video.
Call it tapping as a general term because we're literally tapping on endpoints of meridians of our body. We're tapping on these points while saying certain statements, while focusing on the stress, the challenge, whatever's going on in our lives.
It's this beautiful kind of elegant interplay between energy and psychology.
First of all, I was very impressed with the research, the fact that cortisol levels fall very significantly with the tapping.
Tapping is one of the most directed and powerful ways to peel those layers away of chronic stress.
Without EFT, I don't know where I would be. I don't know what I would do.
EFT just, it saved my life. There's no doubt.
Think of tapping as part of a claim to the possibility of healing. You don't have to believe it. Just tap with me anyway.
Once you experience it, then you know that it's working.
I don't know what more incentive you need than that.
Hello, hi, everybody. Welcome to our emotional freedom technique, log in and learn. Thank you so much for being here today. We at Endeavors are just really appreciative that you took the time to attend this event, and I hope that we can get you some answers today, and I'm going to teach you a new skill. Again, my name is Kimberly, and I am going to teach you this skill called tapping. And as you may have seen in the video, we are going to tap on different points. And we're gonna answer some questions about that and what it looks like and why do we do it. But first I want you to maybe just take a moment to put both feet on the floor and just take a big deep breath into the count of 4. 1, 2, 3, 4, and out to the count of 5. 4, 3, 2, 1. One more big deep breath in at your own pace and out. And I just want you to evaluate how you're feeling right now and what you might want to tap on. When we say that we're going to tap about something, what we're talking about is a specific emotion or feeling or pain or discomfort that you're feeling. And just think about on a scale of 1 to 10 what that might be. If you had to rate the number of that discomfort, we want it somewhere between like a 2 and a 5. That way it's low enough that you can, see the effects and that we can help you in something that's not extremely traumatic. So we're talking something, maybe you have a headache, maybe you have some sinus pressure from the rains that have been falling, maybe you're just kind of irritated at all of the events that are unfolding and the uncertainty of it, and that's totally fine. That's actually what I'm going to be tapping on today, and we'll go more into that in just a moment. But with the next slide, I'll be able to show you how, if your anxiety goes up while we're tapping, how to bring it back down. We're going to be talking about some thoughts, and we're going to be tapping on a pain or whatever you are doing, but you're going to hear me talking about something else. And the wonderful thing about tapping is what we call borrowed benefits. That means that even if you're tapping, you have a need, I may be saying things and tapping along with you, and you'll still gain benefit even if you're not talking about the same thing. So typically when we're tapping, what we're going to do is we're going to talk about a negative thing. We're talking about pain, or we're talking about a feeling, this uncertainty, this anxiety, or sadness from some grief, or whatever you're going to tap about. Why do we talk about that negative thing? We talk about that negative thing because what tapping does is we acknowledge this negative feeling and the body responds to it. So we're going to start with our tapping, and in just a moment, we're going to do a side-by-side screen, and I'll talk about it. But we're going to set up this emotion and this tapping. And you'll see on the screen that there's an area right on the side of your hand. It's the fleshiest part of your hand. And you can take 4 fingers from your other hand and just start tapping on it firmly, but not too hard. And we're going to talk, and we're going to say, right now we're going to talk about the uncertainty of our futures in COVID, and the anxiety that produces in all of us. And we're going to say that really makes us mad that we don't know what's going to happen, or it makes us sad that we don't know that it's going to happen. But this is a key part of this. But it's okay. I'm okay anyway. You can use any one of these acceptance statements. I still love and accept myself. But what's really important is that the acceptance statement that you say after you talk about this negative thing is something that you believe. Because what we're doing is we're bringing up a negative, and our body's having this response. And what we're doing is we're teaching our body to have a different response with the tapping. Tapping on these points helps our body to understand, even though in the past we've had a trauma of some sort resulting in our negative body response, we're safe, we're okay, and it's okay to feel this way, and we don't have to enact our nervous system to get all riled up and active. We can be in a relaxed state. So as we move to the next slide, so we're going to talk about some things, and I'm going to be showing you some actions, not just on this, but I want to give you both this view of these points, and then if you'll just take your mouse and scroll up, thank you so much, to the corner, and you'll have this side-by-side view. If you'll just click on that side-by-side view, you'll have a better view of me showing you those points as we tap. So as you click to the side-by-side view, we're going to start tapping on the side of our hand, and we're going to say again that this anxiety and this anger that I have at not knowing what the future holds and when we'll be able to get back to things that I want to do again. It makes me really angry, but I'm okay. But I want to be okay. Or I want to feel better about that. We're tapping on that side of our hand to kind of set our body up into the other points that we're going to do. And it's okay to feel different doing these points and doing this tapping, or feel awkward. We all feel awkward at first, and that's totally okay. We love and accept you anyway, and if everyone knew how wonderful this was, they'd all be doing it and we wouldn't be awkward anymore. So let's start this new trend of reducing our anxiety, and we're going to move to the top of our head, and we're going to say this COVID-19, it's just really irritating me with having to deal with it, and I don't know how long it's going to take. And then we're going to hit the inside, just inside your eye, but that's okay. I love and accept myself anyway, that I don't know what's happening in the future. And it's okay. You might want to remove your glasses if you're a glasses wearer. But it's okay to be angry about how this has affected my life and how I don't know. There might be some grief on things that have changed or things that have been lost. And that's okay too. It's okay to grieve those things. It's okay to feel overwhelmed. And man, I'm tired of being cooped up in the house. I'm tired of not seeing my friends, of not being able to have social events or to just not cook dinner. And that's okay. It's okay for me to feel that way because I'm okay. And I love and accept myself anyway. So there's these points right here we're going to move to, and it's just below your collarbone. Sometimes it's a little sore, and you may notice that as you're tapping, it could be a little sore. The wonderful thing about tapping is you can do it with either hand. You can do it at the same time. You can alternate it. However works best for you is what you're going to do. You may find a point that's particularly sore, and it's okay to stay on that point. you just read your body and what it's telling you, and hang out right there if you need to. It might be sore for a reason. So the other point we're going to do is if you just kind of almost give yourself a little hug and you just tap right there on the side. And we're going to tap and talk about the fact that even though we don't have to get out in traffic anymore, we have different anxieties right now, and it's hard to deal with those. It's hard to listen to the news every night, and I want to just be able to go back to living what I thought might have been carefree before. But it's okay, because, you know, looking back, it might not have been that carefree. There might be some things that I enjoy more now, and it's okay to enjoy those things more now. We might have had some things stripped away that we didn't want to be stripped away, and be angry or sad about those things, and that's okay too. It might be that we're working harder now. I know here at Endeavors that we're still working full-time, and we've been able to do all of our things from remote, but that means that we're working harder than some of our counterparts, and that can be hard, and that's okay too. It's okay to have all those feelings, because we love and accept ourselves right where we're at, and just acknowledging that is okay. There might be a time where you think about something else, or some other pain or some other thought comes up while you're doing this, and just acknowledge that thought and maybe come back to it there just a little bit. And we'll tap on that at another time. If you haven't started feeling a more calm sensation, feeling your breath slow, feeling that anxiety lessen, then it just means that you just need to tap some more, or you might need to come back to this karate chop point and tap. This point is our anxiety point. This point has a lot of it's like the stress reducer in our hands. The wonderful thing about this karate chop point is that you can do it in a store and nobody knows what you're doing, because nobody really pays attention to our hands unless we talk with them, which I do. So that makes this presentation very convenient. But you can use this. There's also some other points on your hands. If you're out in public and you're feeling that anxiety, you can take and you can just really just kind of rub back and forth on your cuticles, and you might find one that works a little better than the others. This is actually a real natural thing for us to do. A lot of nail biters use this stimulation of the sides of your fingers to calm themselves. That's why they bite their nails. But you don't have to if you just take and you just kind of give it a good little rub back and forth. You'll notice that these points are also points that we tend to touch when we're feeling overwhelmed or anxious or trying to really concentrate on something. We touch these points and these points in that thinker pose, or if we're startled, we grab our chest here. Those are all our innate abilities to calm ourselves, or to focus ourselves, or to relieve some, if we're covering our mouth, or a lot of when we're crying, people tend to cover their mouth. People think it's to stop crying, but there's points above and below that are very grounding, and it's an innate attempt to ground ourselves and compose ourselves, which is okay, because we love and accept ourselves anyway, right? So as we're moving through these points, like I said, you might find one that's more tender. You might find one that works better, that you just really notice that feeling is really calming. And that's exactly where you want to be. We're teaching you all the points in order. You can use them all in order, or you can use them whichever one works for you. I'm hoping that at this point you've had some relief. So you might want to think about what you had, which pain or intensity of emotion you had, and think, where am I at right now? I'm hoping that you will have dropped at least 2 numbers, and that would be fantastic if you could do that. This tapping can take anywhere from 10 to 15 minutes to 30 to 45 minutes. Depends on the intensity of the emotion and what you're working with and how long it's been that you've been working with it. All of those things are factors in tapping. I'm really happy to be able to share this with you today. Thank you so much for giving me the opportunity to. And I want you to just kind of, like I said, think about where you're at right now. If your number hasn't reduced, the great thing about doing this on a login webinar is that nobody can see that you're still tapping. So continue to tap and tap the side of your hand for that anxiety point. Maybe you're really needing some concentration, so tapping around your eyes, or just feeling an overwhelming sadness or grief, you can tap on those mouth points as well. All of those and those right below your collarbone, all of those points will give you relief, and just continue tapping. It has been my pleasure to work with you today. We greatly appreciate you. If you want more information about tapping and the resources, what I have taught you today has come from the EFT manual by Dawson Church, and we're going to put those links up for you and in the chat so that you can click on them. There's also a link for the YouTube video that we showed, but we are happy to, at the Veteran Wellness Center, give you any resources we can and continue to teach you. If you have any questions, you can get in touch with us at the information.
Thank you, Kimberly. That was great. Thank you. I was going right along with you, and I feel very relaxed, so this was good timing for me. Good afternoon, everyone. My name is Annie Erickson. I'm the Senior Director of Veteran and Community-Based Services. So today I'm going to tell you a little bit about our Veteran Supportive Services program that is funded by the VA. We affectionately call it, as everyone knows, military and acronyms, SSVF. So the program is really great in helping homeless or about to be homeless veterans by providing case management service and financial assistance to our veterans. So those that may be currently homeless or may be finding themselves in an eviction situation, we are able to help. So today specifically, though, I wanted to tell you about what we've received as a result of the CARES funding. So at Endeavors, we were fortunate to receive an additional 53% of funds for our SSVF programs. We serve currently 81 counties across Texas, and come this fall, we'll be serving 96 counties across Texas. And so for what that means for Bexar County is that we have additional funds to put forth for veterans who may be behind in their rent. So for those of you who may employ veterans or know veterans that have lost their jobs, please let them know about this funding, because we were able to help them with their rental assistance, and if they're behind, also in their utilities. Our case managers work closely with veterans and their families to increase their income, whether that's through increased benefits or job placement. They help with financial literacy, help with resume building. We have employment specialists and housing specialists that will get the veterans and their families with the goal of being permanently housed and sustainably housed. We've had great success with this program. It's all over the country. There's no charge for the program, and the veterans must be low income at 50%. Right now, everyone's aware pretty much of the moratorium's been against evictions. So while a veteran may not receive an eviction notice and so not think they're at risk of becoming homeless, if they're not able to make their rent, it's piling up. So the rent in arrears is what we can help with, so that when that veteran does get reemployed or gets to a place where they have increased their income and can support themselves, they won't have the burden of the rental arrears that they have built up over time. And as we all know, stuff happens over the course of several months. So we've received this surge of funding specifically to help veterans who are homeless. Again, they can be emergency housed in a hotel. And those veterans who may find themselves needing to self-quarantine because they've been exposed and don't want to be around their families, we can also put them up into a hotel and pay for their hotel stay while they self-quarantine. So the goal of the VA is to keep these veterans safe and off the streets during this pandemic. And it's worked very well in our communities, but we need help in getting the message out so that these veterans will know that this money is available to them to help them and their families. again, our case managers work one-on-one with the veterans to help support them and provide them the guidance that they need. They are able to, they're able to support the veteran all along the way. They have one person to call. They have the case manager's phone number if there is a crisis. So again, a lot of support for the veterans and families, and then the financial assistance that will be paid directly to the landlord or the utility company. We can also help with transportation and other assistance as well. So I encourage you to share this with the veterans that you know who may be struggling. A lot of our veterans have worked in the restaurant industry and have suffered a job loss or maybe furloughed. Here's a map showing where we currently serve. The additional funding we're going to receive will be in the 15 counties, also in the eastern part of Texas, which will be effective October 1st. So again, we cover quite a bit of territory. What this means for San Antonio and Bexar County specifically in the surrounding counties is we have an additional $500,000 in financial assistance alone to help our veterans in our community. So I appreciate you taking the time to listen and hear about our programs, and I really greatly appreciate all you do to help our veterans in our community. Thank you.
Well, thank you all. We will now take some questions from our viewers. If anyone has questions for the Endeavors team, please submit those using the Q&A function. And John, I'll let you kind of marshal where these questions go, or who is best suited to speak to them. But the first question we've got is, from a business perspective, how can we as employers support our veterans who we employ? How do you recommend we approach them if we see some warning signs of a potential crisis?
Well, I'll actually answer that one, partly answer that one for you, Dave. As a business employer, there's an advantage to sending or referring your post 9/11 veterans to Endeavors for mental health care. Obviously, we break down all the barriers to care. We're going to help with transportation if they need it. We're going to help with child care if they need it. But also, we do so at a very low, or in some cases, no cost if there's a challenge with paying the insurance copay. If there are any other challenges, we're going to do our best to make sure that that veteran is taken care of. And in that case, it doesn't cause any impact on the employer's mental health care package. So we think that's a great advantage for businesses here in the San Antonio area, as well as Killeen and El Paso. I think I'll ask Dr. Palmer to answer. I think part 2 of that question was, how can they spot or help see signs of their employees on the job and be able to provide that assistance for them? So Dr. Palmer.
Awesome, thanks. Yeah, that's a fantastic question. I think the full answer kind of depends on what you're seeing, but one of the things we know is that people's patterns will change. How they're dealing with stress or frustration or change in the workplace could be an indicator that someone is struggling with something. This could be anybody. We know, though, that veterans struggle with the transition. There's a certain way of doing things when you're in the military, and when you move into civilian life, there's not one answer to your employment situation. It's not the same at every employment situation. Civilian work is much different in regards to expectations and how that is communicated, where in the military it's very standard. Even when you transition either bases or commands or you move up in leadership, there really is a pretty specific standard way that work is done, communication is delivered. And so the lack of that in the civilian world can be very disorienting and can cause problems. And it can impact people in different ways. So one of the things I would encourage you to do is that if you're noticing that something has changed, if a new employee or an existing employee seems to have some sort of different behavior response going on. Maybe they're late to work when they weren't before. Maybe they're struggling to provide effective information in a group meeting, or maybe you're seeing some signs of anger or frustration. I would encourage that you just have a really good feedback loop with that person's supervisor or trusted coworker, just to kind of check in. And so when that check-in happens, if something comes up, if someone is really exacerbated, like I can't handle these things or everything is awful, kind of that all or nothing talk, I would quickly encourage them to just get some support, whatever that is, whether that's EAP, whether that's some time off, whether that's just checking in and seeing if they've got some support, and go ahead and put words to it. Put words to the fact that you're seeing some frustration. Like, I see that this is really bothering you. This seems new. Can I help? That's helpful for anyone, but especially for veterans if they're moving into your work employment and they haven't had other work before, or maybe this is a move for them and now they're new in your environment, or they've had a change. Going directly at it can be really helpful in a supportive way. Like, I've noticed this change. How can I help? The other piece is Endeavors is here to help. Starting in July, we are going to have expanding funding, so we're able to provide more support to the community. Those folks who have serious mental illness conditions, long-term chronic mental health care, we'll be able to support that now starting in July. The Cohen clinics that we have are short-term care for mostly our post 9/11 folks. So we're now going to be able to wrap around all errors of veterans' needs in the mental health realm of things with some supportive wellness services as well. So give us a call. We have trained intake providers answering our phones. And if you have something out there that you think someone needs help with and it fits our clientele, veterans of any era, we'll try and walk you through it. I hope that answered the question.
Absolutely. Thank you, Dr. Palmer. Following up in a similar vein, from an employer's perspective, are there some best practices to support veterans in their quality of life?
I'll go back to Dr. Palmer on that question as well.
Sure, I'll take that. Yeah, so quality of life is something I'm passionate about. It's actually, I did my research in quality of life and post 9/11 veterans. And the thing that I learned is one of the reasons why we're opening the Wellness Center is that quality of life means different things to different people. So one of the things I would encourage in your employment setting is to find out what quality of life means to your employees. Does it mean an extra half hour at lunch? Does it mean being able to pick a day where I can come in a few minutes later? Does it mean, having candy bars in the vending machine? It's important to find out what does quality of life mean to your folks, and then figuring out how you can support that. Exercise, obviously, physical health is one piece that research shows connects, it improves our quality of life. Being able to connect to other people, having the ability to do our work in an effective, meaningful way, having purpose, having things that are in our lives actually support us. So if I am needing to take medication, especially allergy season has been brutal for me this year. So being able to make sure that I've got the ability to get my allergy meds, take my medicine, be able to have them work. Those things improve my quality of life, coworker connections, the commute. So I have really enjoyed this work from home time. My commute is like 30 seconds compared to like 45 minutes. So though all those things impact quality of life, but the thing I can tell you as an employer is that if you're not connected to your employees about what improves their quality of life, then no matter what you do, it may not help. So find out what they want. Find out what quality of life is to your employees.
That is great. Another question we've gotten is what resources are available to families, spouses, and children in particular of active duty personnel outside of the installation, not on base, and then should they be concerned about confidentiality?
Sounds like I might take that one again too. So I'll just jump in. So Endeavors does have care for families and children. So the Stephen A. Cohen Military Family Clinics that are all doing virtual care right now, we are providing mental health care to dependents, so family members of active duty and their children. Now, we have some virtual care for children depending on age. generally, we're talking more about that teenager realm that can do the virtual counseling techniques. When we get back to being able to have some in-person services, we do have a play therapy room, and we see kids as young as 3 or 4, but that's not really supported for that individual care over virtual care, but we can support parents. So if there's a parenting technique or parenting support there, we can do that at the clinics. The clinics have their own secured electronic health record. It's not connected to the DOD. It's not connected to the VA. So there is privacy there for if that's what the question is about. And there isn't any transferring of records outside our system unless you need for that to occur, which is called a release of information, and you make that decision, unless, of course, there's some sort of safety issue. If there's safety to yourself, to a child, if there's suicide risk or self-harm, then our job is to keep people safe, and we will do that to the extent that we need to. And that's discussed in all of our intake paperwork as well.
That's great, Dr. Palmer. We got another question that came to us through the chat, and it says, what is the current process for continuity of care for behavioral health care after they are discharged from short-term care, i.e. counseling services, pharmacological management, et cetera?
Wow, that's a great question. So someone must be inside my brain. So it's one of the reasons why Endeavors is expanding our services is because we had a bit of a lag at Endeavors for continuity of care. So starting in July, there will be long-term services available for adults and children, serious mental illness, substance abuse recovery, chronic conditions with Endeavors staff. We are currently looking at hiring now for those positions. What we do now, the 3 clinics work from the beginning to figure out what folks will need for long-term care. Long-term care means different things for different people. Endeavors does not do inpatient or residential care. So if a higher level of counseling or mental health care is needed, we work with our local communities to vet and connect with people to refer them. We have a dedicated outreach staff, and that is main part of their job is to have referral sources available and vet and reconnect quarterly or more often with referral sources so that we can have continuity of care available. We also work with primary care providers, the VA, and other long-term care providers to make sure that we've got referrals available. We also have case management in all of those clinics as well, and they help with continuity of care and getting folks connected for care that is not available inside the Endeavors clinics.
That is great. Well, kind of following on an earlier comment you made, suicide is a serious concern in the military and veteran communities, and there has been a reported rise during the COVID crisis. What can we do to bring more awareness and connect service members and their families if they need help?
Yeah, so we have definitely seen a rise in calls to crisis centers, and we do have a suicide problem in the United States, and we've had one before the COVID-19. The difficulty there is the isolation, the lack of connecting to your normal go-to spots. So 2 things. 1, I would make sure that you're connected with people and that you can do that. We're connecting right now. So expanding our definition of what connection is really important, and I would encourage you to stay connected with folks. The second thing is to ask. If you believe that someone's behavior has changed and you think they may be at risk to die by suicide, ask them. Ask them if they are thinking about dying by suicide. Ask them if they have made a plan. Ask them if they have something right now close to them or in their presence that they could hurt themselves with. If those answers are yes, get them help. Don't let them be alone, and don't let them talk you out of needing to get them some care. We have the ability in our brains to solve problems. Our symbiotic part of our system, the part of our brain that keeps us safe when we used to live in caves and run away from animals, is the same part of our brain that helps us solve problems. And when we are depressed and anxious and feel like there are no answers, we will create an answer. And our brain decides, although incorrectly and in error, that dying might be the answer. So lots of people come through that thought process, but not everyone needs to die from that. And if we ask and are okay with the answer and can move forward with getting them care, we can help folks and we can stop people from dying.
Well, that's great. Thank you, Dr. Palmer. Great words. A lot of time can pass before a service member seeks professional help, particularly when they're on active duty and they're afraid of the stigma of seeking help. What are the best ways to encourage veterans or service members to seek help before their service ends or as soon as possible?
Sounds like that's me too, unless someone else wants to jump in on your experience. I think that the piece there is, everyone makes decisions for what they believe is best in their life on their time schedule. So it's really important to honor where people are at, but also to go ahead and provide information. You can send emails with links like these to how you get information. We are available for people no matter where they are. The Cohen clinics provide care primarily to post 9/11 veterans. That's their main mission. And then starting in July, Endeavors will have mental health care for any era veteran with chronic mental health needs and peer support needs. So Endeavors can be an answer to many communities across the state of Texas, especially in San Antonio. So you can have them call us. But it's also okay if they are moving forward and not harming themselves, it may just take them longer to get care. But we're here whenever they're ready.
That is great. It's great to have you here. Are you finding an increase in family violence in the military and veteran families, similar to the civilian population? How can we assist families when dealing with service members in crisis? You've already hit on some of that, but are we seeing the increase and what can we do?
I mean, the domestic violence and intimate personal violence and violence in relationships is something, unfortunately, that San Antonio and Bexar County has a high prevalence of. We know that from some assessments that have been done across our area. The military also struggles with this expression of family and intimate partner communications. So I'm not exactly sure at this very moment if the research is saying that it's increasing or that we have a higher prevalence here in this community than some others, but it is definitely a problem. There are many resources to get people support either through the military community on the bases or out in town, and Endeavors does support that. The Stephen A. Cohen Military Family Clinics provide support to families, whether that's joint couples counseling before the violence has occurred, whether it's individual counseling while there's violence or aggressive family discord going on. We have support to children. So violence in families is doubly impactful for children. When they see violence in their families, it can impact their ability to learn, to grow, to have a healthy weight, to finish college, and to be able to move forward in their lives. So we provide that care for kids as well, counseling support for them. So we can also be an answer there as well.
Thanks, Dr. Palmer. Maybe this one will go to John. Final question, John. Are there opportunities that the businesses in this community can support Endeavors and specifically the military and veteran initiatives?
Absolutely. We are always looking for opportunities to find strategic relationships through the city, state, and nationally. I would just ask if they reach out to me directly. I'd be happy to start that conversation. We have many businesses that already support here in San Antonio. USA has a program with us for the Navigator program. That is within Annie's purview since it deals with homelessness in the city of San Antonio. And we have many other folks that help, but we definitely have a need to expand our services in the veterans realm and look forward to partnering with more local businesses to do that.
That's great, John. Thank you. Well, I'd like to thank John, Chip, Jill, Kimberly, and Annie for taking the time out of your busy schedules to be with us today and to address this important topic. I'd also like to thank everyone who joined us today, and a very special thanks to our sponsors, Civil Engineering Consultants, the San Antonio River Authority, and Silver Eagle Beverages. As a reminder, this webinar was recorded and will be added on the Chamber's Rapid Response website soon. please visit www.sachamberrapidresponse.org. Again, any questions we were unable to get to today will be shared with our speakers and on our Rapid Response website once answered. I'd like to highlight our next event, which is tomorrow, May 27th at noon, our Congressional Series web event, which features Congressman Henry Cuellar. He is an appropriator and very involved in many of the actions that are going on at this time. Also, please join us for Mayor Nirenberg's 2020 United State of the City address, which will be live streamed on WebEx on Friday, June 12th at noon. During the interactive event, he will address tough questions about the future of our great city. Lastly, I want to remind everyone about the 2020 census. As you know, the success of our entire community depends on successful census count. Information from that census will drive decisions that affect business growth, social services, government representation, and more. Texas stands to gain 2 or 3 seats in Congress from this census count, and an undercount of just 1% could mean losing out as much as $300 million per year in federal funding. It has never been easier. You can self-respond by phone, mail, or email. If you've not already completed the census, please take a few minutes and visit 2020census.gov. If you have, please encourage your friends, neighbors, and teammates to complete theirs. With that, we are complete. Be safe, be kind, be healthy, and from all of us at the San Antonio Chamber of Commerce, have a wonderful day.